Hello, my name is Gavin Setzen, and I'm here today to share with you some of the great value and importance of the Academy Reg-ent Clinical Data Registry. This has been a tremendously important initiative of the Foundation, and this became available to membership in mid-2016 and was fully operational for the annual meeting that same year. CMS designated Reg-ent as a qualified clinical data registry in 2016 and again in 2017. This is a complex process and requires significant oversight and governance. And so in May of 2016, a governance structure was put in place. And as you can see, a diverse, highly qualified group of individuals brings significant expertise to this process, including representation from the American Board of Otolaryngology. The clinical advisory committees within Reg-ent provide content and expertise within each of the subspecialties within our field. And as you can see in this slide, facial plastics, general and sleep, head and neck, etc. are all represented, and the specialty society will nominate an individual to the CAC, and then this is approved by the EC, and the Reg-ent EC and oversight structure reports ultimately to the board of directors. So the key moving forward is, how does one optimize Reg-ent not only now but well into the future to provide value for you, the member, and to optimize the best quality care for our patients? Participation is really essential, and this is an important consideration. This is the most significant initiative by the Foundation, which committed a significant amount of dollars and resources in terms of staff and other time to this process. And really, it's a very substantial quality improvement initiative more than anything else. This data registry empowers our specialty to determine specialty-specific quality indicators by which we will be measured, rather than having an outside entity or regulatory body do that for us. It is also important that we as otolaryngologists define this quality and the quality of care that we can continue to monitor and improve upon moving forward. The aggregate data will continue to evolve, refine the information available, and in so doing, allow us to optimize the value to both you and your patients. As the registry grows and more data accumulates, the strength of those numbers and the quality of the data will facilitate its transformation. This will improve a variety of issues, including continuing medical education opportunities, quality improvement, patient improvement activities, maintenance of certification requirements, and a variety of other important areas specific to our field. Currently, we have 5 million unique patients and 11 million total patient encounters within the registry, and that is a substantial number considering that we are still in our relative infancy. And there are 2,000 physicians contributing. So it is really important that as we grow participation, that data becomes much more robust, meaningful, and useful in clinical practice. And Reg-ent will harness the power of that data to substantiate the things that we do on a daily practice and make them much more meaningful. So most importantly, as I stressed earlier, Reg-ent allows otolaryngologists to define quality as it relates to our field. And as long as we can continue to define that process and control that process, we will be in a much better position to interact with quality initiatives required by CMS, regulators, and policymakers, etc. So, moving forward, it's important that Reg-ent should be seen as a tool that has enormous value for all otolaryngologists. For otolaryngologists who are solo physicians in private practice, rural and urban settings, small and large practice groups alike, and certainly employed physicians, and I'd like to stress that. Reg-ent is of great benefit to employed physicians as well, academic medical centers and large health systems as well. And it really affords the opportunity for every otolaryngologist in every practice setting. I like to think of it as the great equalizer. We can all report the same way, independent of how or where we practice. And that is an important differentiator. And certainly MIPS reporting is a key capability of this registry and is very important from a CMS perspective currently. So the value, and really all of the members participating, is in the data collected and how that data is utilized. The data will help to develop more relevant and useful measures. It helps the specialty measure the care and, importantly, the quality outcomes for our patients. And in so doing, we can continue as individuals and as practices to improve the quality care that we provide on a daily basis. So there are really a lot of important safeguards, and the important aspect to this is that we want to use the data as otolaryngologists to continuously improve patient care. It is important to represent the data visually so that you can monitor your progress and determine your clinical practice, individual and comparative performance relative to others, and show that the services we provide are valued and how we might continue to improve those. It's important because the value of our services determines our ability to participate in alternative payment models, value-based payment systems, and with this data, we will be able to compete effectively in all future payment models which will look to this kind of material to facilitate our participation. And it is important to realize that Reg-ent has otolaryngology-specific measures within our field to facilitate that quality reporting requirement. The first phase of the registry is very important. PQRS was the tool used in 2016 and MIPS in 2017, 18 and beyond at this time. So it's important to know that the Reg-ent registry accommodates the three categories required by CMS in terms of the composite scores for reporting: quality, advancing care information, and clinical improvement activities. There are over 650 physicians currently reporting, a six-fold increase from when PQRS was used. And certainly this continues to grow, and your participation is really helpful and necessary. So the MIPS dashboard was completely revamped, and this incorporates the composite scores for CMS and provides a visual dashboard by which you can determine how you are performing in the individual categories and your overall composite score. And you can compare yourself to others within your practice, your community, peers around the country, and develop an idea of how you're performing, what needs to still be done, and what scores you will be submitting to CMS. And you'll be able to do that in real time and on an ongoing basis. So this is a particularly useful tool. Currently, the quality measures are continuously being reviewed and developed. And again, they are otolaryngology specific. There are 63 measures available for MIPS currently. And I would encourage you to review the data because the Reg-ent 2018 QCDR measures are robust, and this cannot be stressed enough. When you look at the distribution, there is a plethora of quality measures that apply to each and every one of our practices, and this is certainly being bolstered on a day-to-day basis. Beyond reporting, there are certainly research and quality improvement activities that Reg-ent will help to facilitate. The Reg-ent Executive Committee and staff are working on an ongoing basis to identify policies and procedures for Reg-ent data for research purposes on an ongoing basis. In addition, research and education staff are looking at quality improvement projects. All of these become important tools within one's practice, and also as it relates to continuing activities with respect to CMS reporting. And many of the practices are involved in QI, quality improvement issues, using the Reg-ent dashboard, and I encourage you to evaluate that and certainly to participate at the highest level possible. Where do we go from here? And I think the value moving forward cannot be overestimated. And the value in terms of your reporting, demonstration of quality, and improvement in patient care, as well as research and educational opportunities. But beyond that, there are private payer incentive programs. For example, FigMD, the technical partner for Reg-ent, is in discussion and negotiation with private payers to develop incentive programs for participants in Reg-ent who are able to demonstrate quality. And this will result in a differential reimbursement, which is significant to those participating in the process. And one such negotiation will be concluded mid-year approximately, with others to potentially follow. And that is a significant development and a great opportunity for the participating otolaryngologist. In addition, it addresses critical member needs in terms of quality, clinical practice improvement aspects with respect to MIPS, and that is substantial. It documents the value of our care and the care that we are able to provide so that we can demonstrate the quality to our patients, to payers, to regulators. The work that we do, this is an opportunity to demonstrate outcomes and quality for otolaryngologists. In addition, it allows us to track patient outcomes over time and assist with development of alternative payment models. Very important in an era of alternative payment models, value-based payment, and a very fluctuating healthcare environment. So optimizing Reg-ent value is critical on an ongoing basis, but that requires participation from as many Academy members as possible. And that's where we ask you to explore this fully and to participate in Reg-ent. Understand the value now and well into the future. And if you're not the person within your organization making the decision, take this information, educate, advocate on behalf of Reg-ent, because in so doing, you're advocating on behalf of yourself, your practice, and every one of your patients, and indeed the field of otolaryngology as well. The power of the registry is in the data, and that data will drive outcomes, and the usefulness of that data will only continue to increase with higher levels of participation. So we encourage members in private practice, academic institutions, vertically integrated systems, large groups, etc. Every otolaryngologist should participate to maximize the potential benefit across the board. One needs to understand again that you will realize financial benefit from participation, but will also be able to have direct input into how you are monitored, measured, and reimbursed going forward, not to mention the quality improvement opportunities within your practice. This will also facilitate improved advocacy efforts for the specialty overall. So in order to optimize, participate, I encourage every one of you to get involved in the registry. There is an important opportunity here. Provide requested documentation, participate in mapping calls. There are many opportunities to work with Academy staff and FigMD to make sure that your practice is participating at the highest level, and to optimize the process by which you can review your data and report. There are certain expectations. It is a process that involves a certain amount of time commitment to facilitate the mapping process. It's not a click on, click off process, but once up and running, clearly the value cannot be underestimated. In addition, when you look at the workflow as it relates to your electronic health record, documentation changes may need to be applied to facilitate appropriate data capture, and that's where the mapping process may vary from one practice to another. And it can be challenging for certain practices, but the staff support and the vendor support cannot be underestimated there either in helping to facilitate the process. So there are many different EHR vendors involved in this process. Reg-ent is able to work with most of them. Reg-ent works in terms of data housed in your electronic health record or cloud-based systems. And the process is slightly different, but certainly the data can be extracted for the most part in a seamless fashion, having facilitated the initial processes required to do that. As you can see, there are many EHR vendors participating in Reg-ent. This is by no means a comprehensive list, and certainly the vendors continue to interact with Reg-ent and the Academy to optimize broad-based participation and to facilitate ease of participation as well. So, in closing, in order to optimize the potential benefit and value from Reg-ent, I encourage every one of you to explore this option very seriously, to participate at the greatest level you can, whether you're an individual, solo, private, rural practitioner, or an employed physician in a large integrated healthcare system. The benefit is there. It is ours for the optimization and utilization to improve quality patient care, to improve mechanisms for reporting, to facilitate otolaryngology specific driven quality measures, and to optimize the things that we do and care about on a daily basis for the field of otolaryngology. So get involved, participate, and help grow Reg-ent as our tool for sustaining the future of otolaryngology for many years to come. The Foundation has made a significant investment in Reg-ent. This is our opportunity to take it the rest of the way and make it the tool that will allow us to be continuously successful in otolaryngology practice. Thank you.